And our next presenter is Dr. GYAN BHASKAR. He is speaking on physiological tearing and case selection in DCR. Time allotted is 7 minutes, 7 to 8 minutes.
Dr. GYAN. इसको भी बार में कर दीजिए बस. इसमें कर दीजिए. नहीं आ रहा. Good afternoon, everyone. Thank you so much, sir, for giving the opportunity, and may I thank the scientific committee of AIOS for this opportunity also. Chalo DCR Pathshala. In this session, I am going to discuss about the physiological tearing and case selection. After the proper knowing the anatomy of the lacrimal passage, physiological tearing and case selection is a very important part. As we know, the tear secreted by the lacrimal gland passes through laterally across the ocular surface to the lower canaliculi, and then they finally pass through the lacrimal sac to the nasolacrimal duct. Tearing can occur due to the excessive secretion or blockage in the internal lacrimal passage. Tearing may be either it is due to the psychosocial stress or due to the reflex lacrimation. Where we are dealing with, we are going to discuss about the obstruction in the nasal passage. Some of the cases are presented with like this young child presented with the matting of the eyelashes, some discharge, swelling over the sac area, cystic lesion, and so it is very important to diagnose these cases. And the other presentation would be in the younger child, like fistula, swelling, and discharge. Some of the patients are also presented with the preseptal cellulitis, swelling, and some of the patients present with the pain and swelling of the lid at the sac area and involvement of the upper and lower area of the lid. Some of the patients also presented with in the younger age group, like tearing, swelling, and some of the patients are also present with the mucus and mucopus discharge. And also some patients came to us with the post-operative blockage of the nasolacrimal passage. And in the older age group, some patients may present with the mimicking with the cystic swelling. It may be the other lesion other than the sac lesion. So it is very important to diagnose. The main aim of diagnosis is to first to confirm the diagnosis, then to evaluate the status of the sac, and to exclude any nasal pathology, so that we make to plan the surgical procedure to minimize the complication and increase the success rate of DCR. For the evaluation, we have to take the proper careful history. Here, history is very important for the diagnosis of any kind of disease. Like in the cases of dacryocystitis, the patient is presented with the watering, the proper history should be taken regarding the one side of the disease or any trauma or any pathological lesion or any systemic osseosis should be taken care, should be properly, history should be taken. In the clinical examination, inspection is very important regarding any discharge, matting of the eyelashes, or any swelling of the around the sac area. Swelling may be in the above and below the medial pulpal ligament. The nature of the swelling and nature and condition of the skin should also be look. Then the proper slit lamp examination is mandatory to rule out any other causes of watering, like entropion, distichiasis, trichiasis, or any ocular surface disorder, anterior chamber should be examined. After the slit lamp examination, just we have a OPD procedure like regurgitation test, syringing test, and some dyes should be used to rule out the pathology, to rule out the obstruction in the nasal passage. And one important thing is to examination of the nasal examination, if you have the endoscope or with the help of our ENT colleague, nasal examinations should be mandatory. And if required, we can go for the imaging technique like in the failed DCT or DCR cases. Just you see here in the regurgitation test, you can just push over the sac area and you see there is the regurgitation is positive or not. If there is a regurgitation is mucosa, mucopus regurgitated, it indicates that there is a blockage in the nasal passage. If there is no regurgitation, it indicates that there is a common economic blockage. Sometimes there is negative regurgitation can occur if the patient came to with already expressed their sac manually. If it is not confirmed by the regurgitation test, then we go for the syringing procedure. By the help of syringing, we can rule out where is the blockage, either it is nasolacrimal blockage or it is blockage in the common coloculi or canaliculi area. Probing test can be done to rule out soft stop or hard stop. In cases of there is a soft stop, then it indicates that there is a blockage in the nasolacrimal duct. Then in the younger child, if patient is uncooperative, then we can go for the fluorescein dye disappear test. Just instill a 2% fluorescein dye to the cul-de-sac area, wait for 2 minutes and just observe. You see here there is a fluorescein dye was instilled in the patient eye. One in the right eye dye disappear, but there is a left eye, the dye is present. It indicates that there is a blockage in the nasal passage. We can also go for the Jones dye test. It indicates that there is the primary test differentiate from the watering for the partial obstruction or the primary hypersecretion. And Jones dye 2 test also we can syringe with the normal saline and observe for the cotton swab put on the nasal cavity. If there is a cotton swab is stained with the dye, it indicates there is a there is a pattern. That means there is a partial blockage or physiological failure, pumping failure. If there is a fluorescein dye is not observed, then it indicates that there is a blockage, complete blockage of nasal passage. Then we can go for the X-ray or imaging technique like dacrocystography or radionucleotide dacrocystography to rule out the remain sac in cases of DCT or failed DCR, so that we can make a plan for the further treatment. CT scan or MRI can be done in cases of this type of the suspected cases to rule out the mass lesion and underlying bony condition. Before, in the cases of congenital diagnosis of congenital cases, one should look for the if the patient is having the photophobic, then there must be the cause of other lesion other than the dacryocystitis. And if it is not possible, then we can go for the examination under anesthesia. Before going to the any management, systemic evaluation is mandatory. Pre-operative checklist should be care of the control of the blood pressure, ENT evaluation, if patient is on blood thinner should be stopped, or pre-operative medication, ethamsalate or nasal decongestion can be used. And patient always should keep your anesthetic in OT if required general anesthesia. So ideal case should be the regurgitation test is positive, and if you want to go first DCR, then we choose a patient of the mucocele or the bigger, we can get a bigger flap. So flap make is very easy. So conclude that careful history is mandatory, and careful examination is also should be done, and it should be differentiate between the common clavicular and nasolacrimal duct obstruction, and treatment plan should be done according to the condition of the and blockage, vary the blockage. Thank you so much.